I'm Dr. Birchler from ChiroHealth Spine and Disc Center. One of the more common problems we see in our practice is low back pain, as a person might imagine with chiropractic. Low back pain is the number one reason in the world for disability, difficulty working, and earning income. So it's a big deal. And of course, there's a range of severity from stuff that's pretty simple to stuff that's very complex. Maybe people who've already had past surgeries, procedures, and things like that. So when people have problems in the low back, they can obviously have back pain, and that pain may seem to extend down into the pelvis or tailbone or the hips. And a lot of people will get pain syndromes into the legs or the feet, in particular with spinal disc problems. That can range from numbness, tingling, cramping, sometimes weakness with pressure on nerves. And those are things that they deserve some serious attention to get evaluated and get the appropriate care. In terms of helpful tips to try to minimize back pain, not everybody's the same, but a few things that are pretty common is very extended sitting can certainly correlate with back pain. Studies in the workplace have shown that for people that have back pain associated with sitting, the more frequently they get up during the day, it does minimize some issues or expenditures in low back pain. So get up more frequently when sitting and driving. Sleep position can be a big issue. People who sleep on their stomach or things, that over time, I really see that cause them a lot of problems. And again, not everybody's the same in that position, but got to make sure that you are in a position that's not really stressing your body while you sleep to the best of your ability. And then things that improve mobility, kind of limberness, flexibility, and strength are all wonderful things. Walking, maybe hiking, those kind of things that strengthen the spine and the hips and the gluteal muscles. Those things can be very helpful, even more so than lifting if people are having back pain. Some types of stretching, sometimes things to keep mobility are good. Some people dealing with disc problems and sciatic nerve issues, and they try to stretch. It can really aggravate things and make them worse. So you have to be kind of careful with that. And then things that strengthen the core, things that strengthen the midsection, but don't stress the disc are helpful. You contact our office. We have some videos we send on this of things we know that are safe even for people with spinal trouble, disc problems, and things like that. In terms of treatment, if something doesn't resolve on its own, things that are more chronic there, we always want to start by getting some imaging, x-rays and or MRI if appropriate, so we can really see what's going on. And that way we can prioritize safety, comfort, and results for somebody's care. Many of the cases we see respond very, very well with chiropractic care. Adjustments of the spine, get pressure off of the joints, open the nerve holes, alleviate nerve pressure, and those kind of things. Works wonderfully for a lot of people. Some people, however, have things like disc bulges, disc herniations, or degenerative discs, and those things may respond better to a type of decompression type of force on the spine that can let the discs pull away from the nerves, oftentimes being relieving back pain and leg pain, and maybe a necessary treatment for certain things that haven't responded to other types of care. If you're having trouble with something like this, we're always happy to talk with you, do a free consultation, look at any past imaging or studies you've had done, and determine how we can best help you.